What's the most common sexually transmitted infection? Let me give you a hint. Everybody in this room has it. Life is the most common sexually transmitted infection. Your father's sperm infected your mother's ovum, the ovum she made inside your maternal grandmother. That produced a zygote, and 9 months later, here you are. How are we going to treat this infection called life? That's what I want to consider today. So we need some kind of a metric to sort of measure this. And I worked as an ER doc for many years, and the easiest diagnosis for me to make in the ER was that somebody was dead. It's very hard to fudge. So I like mortality measures of health. Since we collect those data, we can aggregate them and analyze them. So let's look at health of societies using the results of the sexually transmitted infection to look at how healthy is the United States. So some years ago, I was casting around for a metaphor to use for comparing health of countries. And I came up with the term, the Health Olympics. Suppose health were an Olympic event, and we have racked up the most medals in Olympic history. We typically do very well. And here we go. So suppose health were an Olympic event. Suppose the race was how long you lived. That's called life expectancy. And so here's the United States, richest, most powerful country in world history. We spend more on health care than the rest of the world combined. So how healthy are we? How many here would give us the gold medal? How many would put us in the top 5? 6 to 10, it's hard to see out there. 11 to 15, more hands go up. 16 to 20, more hands. 21 to 25, 26 to 30. How about below 30? Okay, so here is the 2015 running of the Health Olympics, with the top 35 countries ranked by how long we live. All the other rich countries have longer lives than we do. We're number 35 there. The gap between us and the longest lived country is Japan, is such that if we eradicated our leading killer, heart disease, we still wouldn't be the healthiest country, but we'd be close. In addition to all the other rich countries, Chile, Malta, Slovenia, Costa Rica, Cuba, even Lebanon, they have longer lives than we do. So hopefully you're asking why. And you probably think it's personal behaviors, right? So out of all the countries on this list, which country has the lowest proportion of men smoking? Turns out to be the United States and Sweden. Which country in this list has the highest proportion of men smoking? Turns out to be Japan and South Korea. When I came across this information, I had to discard the usual factors that I thought made a population healthy. It just didn't compute. So here we are, less healthy by a large margin from so many other countries. Yes, we're healthier than countries in sub-Saharan Africa, but is this what we want? We want, if you said on your deathbed, thank God I lived a shorter life, I wouldn't want to live a longer one, you'll be rewarded for living in the United States. So that's how long you live. Let's take some other measures. Again, looking at mortality. Suppose we look at deaths of women in childbirth. That's called maternal mortality. I wrote in my medical school notes back in 1971, we had the lowest deaths of women in childbirth of all countries in 51, 53. And now there are almost 60 countries that do better than we do. And not only that, our deaths from moms in childbirth are actually increasing. They've gone up 50% in the last 15 years. Only 8 countries in the world have seen an increase like that. And so we're in the league with Afghanistan, Guinea-Bissau, South Sudan. This is remarkable, and most of us are totally unaware of that, so we can't do much about it. So that's how long you live, moms dying in childbirth. How about child mortality? I mentioned Slovenia, and so why is Slovenia important? It happens to be the country of birth of our First Lady. Suppose we had Slovenia's child mortality rate. How many fewer children under 5, would die every day in this country that wouldn't if we had Slovenia's child mortality rate? No reason you should know that, but the answer is 43. That is, 43 children die every day in this country that needn't, since Slovenia shows what's achievable. So I hope by now you're sort of wondering, why might this be the case? Well, I want to make two arguments. One is that early life is incredibly important for our health as adults. And the other is that more unequal societies where there's less caring and sharing, especially in early life, have less good health. So as we go from the erection to the resurrection, the first 1,000 days after conception is when roughly half of our health as adults is programmed. So it's that critical period in the first 1,000 days that really matter for our health as adults. So what do healthier countries do in this period of time? Well, there are only 2 countries in the world that don't give a working mom who has a baby paid time off work as a nationally mandated policy. The United States, of course, is one, and the other is Papua New Guinea. So we don't invest in the part of life that really matters. We also have the most child poverty of all rich countries. 23% of children live in poverty in this country, and so that can't be good for our health. I also said the gap between the rich and the poor is incredibly important. Healthier societies have a smaller gap between the rich and the poor, and less poverty, of course. So how big is our gap between the rich and the poor? Well, 3 people in this country have as much wealth as the bottom 160 million. And 2 of them live a stone's throw from here, Bill and Jeff. That's not good for our health. What we have learned is that inequality kills, and it kills early in life. And how do we cope with the vast inequality in our society? Well, it causes a lot of stress. Road rage, air rage, all sorts of stress, and especially stress at work. So this is a street sign from Oakland, California in the early 1980s. Stress at work, powerlessness is bad for our health. What's our response? Call 653-6166 for stress counseling and family counseling. Is that going to do it? I would suggest not. So I think stress is the 21st century tobacco. It is really we have an enormous amount of stress in our society. Some of the other speakers have alluded to that. They've also alluded to child poverty with the school lunch issues. So what are we going to do about this? Well, some of us consume opioids. So this is a map of opioid consumption around the world, and you can see with our red, we consume the most opioids of any country per 100,000. Number 2 is Russia. They consume a lot. 3 and 4, the other 2 countries are Iran and Iraq. All the other countries don't need opioids as much as we do. Why do we need these opioids? Well, to sort of cope with stress and get through the day. Notice we're talking a lot about harm reduction. We're talking about having naloxone in the same places we have AEDs, the automatic emergency defibrillators. Nobody's asking, why do we consume so many opioids? It's the stress in our society. So what are we going to do about this? Well, medical care, we can't look at for the answers. So the sink is overflowing. The healthcare workers are vigorously mopping up the floor. What needs to be done? Somebody's got to turn off the spigot, right? Whose job is that in the United States? The equivalent of making us healthy compared to other countries. Well, I would offer nobody. We spend 1/6 of our total economy on medical care, $3.3 trillion in 2016, and as I said, more than any other country combined, and we can't boast of good health outcomes, so that's not good. So what is needed? Well, we have to recognize that early life is incredibly important. Frederick Douglass, an escaped slave and abolitionist, said 150 years ago, it's easier to build strong children than repair broken men. But we have a huge industry repairing broken men and women, so we need to focus on building strong children. So let's not have the most poverty of all rich countries. Let's have a nationally mandated paid parental leave policy. How many people recognize these ideas? Well, our longest lived state is Hawaii. And the health department in Hawaii produced this graphic of downstream Makai and upstream Mauka root causes of health issues. Downstream are all the chronic diseases that you're going to die from. Beyond that are risk factors, smoking, lack of exercise, health care. Then around the waterfall, we have racism, discrimination, poverty, income and wealth. Notice above that are socioeconomic conditions, what I've been talking about, the gap between the rich and the poor, and political context and governance. Health is political. We need to recognize that. We need to put in place political policies to make us healthy again. These are the determinants of health of societies. So we need a procedure. We need a surgical procedure. We need political medicine. We've got to create a society where we don't have to take from the rich and give to the poor, but everybody is taken care of. How are we going to get there? Well, remember the African proverb, if you want to go fast, go alone. If you want to go far, go together. How are we going to go together? We need to learn to organize. The old saw, you give me a fish, you've fed me for a day. You teach me to fish, and you fed me until the river is contaminated or the shoreline seized for development. But if you teach me to organize, then whatever the issues, I'll work with my colleagues and we'll fashion our own solution. We should be teaching organizing at the University of Washington. I was talking to our MC. He's a school teacher down south, and maybe he should be teaching organizing in the schools there, in middle school and high school. We have to organize or we're going to die. Thank you.